On April 15, 2020, Premier Doug Ford made a promise.
We will fortify the iron ring of protection around our long-term care residents.
Over a year has passed and nearly 4,000 long-term care residents and 11 staff members have died from COVID-19.
Ford talked about his iron ring. It never happened. They had a chance to make a difference in the second wave, but they didn't.
I think back to all the times that we had to say to the government, there is no iron ring. Please bring in some help. They need help. And, they always had excuses.
We have to put an iron ring around.
The province launched the Long-Term Care COVID-19 Commission last July. The final report says Ontario was not prepared for a pandemic and had no plan to protect residents.
They knew something was coming. There were warning signs before the pandemic. There were warning signs at the start of the pandemic in other countries. The cruise ships revealed to us that congregate care facilities would be a disaster.
One of the things we learned from SARS, which is you have to assume things are going to be heading your way and that they're going to be bad and you have to prepare for it.
But the province did nothing dating back to 2003, says official opposition leader Andrea Horvath.
The Liberals had 15 years and, really, long-term care was on its knees when the Ford government took over, but they just kept cutting. So they did the same thing that the Liberals did, which is just so frustrating.
The commission cites underfunding, a lack of oversight, and a staffing crisis. Healthcare Union Worker President Charlene Stewart says the Ford government's response so far won't fix any long-term problems.
The temporary pandemic pay, the temporary wage enhancement, now temporary sick pay. What? You respect and honor these workers when their lives are at risk, but then they're going to go back to the exploited conditions that they had pre-COVID?
She says 30% of workers in the sector are not returning. Lisa Scott is one of those workers.
I'm not the only one who left. Lots of us have left.
Scott worked at Grace Villa, home to Hamilton's deadliest outbreak, where conditions were described as a war zone. She eventually took a 3-month stress break.
And I tried to go back. I did. I tried to go back in February, and I lasted 2 hours. And I was bawling my eyes out, having panic attacks. I just couldn't do it.
Brian Melnick's mother, Joan Wallace, was the 44th person to die of COVID-19 in Hamilton. She was the 16th death at the Roslyn, site of Hamilton's worst first wave outbreak. He says his last memories of his mother are awful.
Behind a window waving to her at the Roslyn, behind a glass wall in the hospital. So, that connection, even if it's their last few minutes, means a lot.
We are not allowing visitors.
The report stresses the importance of family care and support to residents going forward. It also takes aim at a provincial government that was slow to act. In a statement, Minister of Long-Term Care Marilee Fullerton writes, since the Commission started its work, the situation in long-term care homes has dramatically improved as the province ensured residents and staff were first in line for vaccines. But family care specialist Dr. Vivian Stamatopoulos isn't buying that.
This minister has the audacity to say that things have dramatically improved when the only thing that has changed is vaccinations and the decrease in mortality. Nothing else has changed. The systemic problems remain.
Now, the report says new facilities need to be built to address the province's aging population, but Ontario needs to reconsider how those homes are managed. Many advocates for long-term care, including many you heard from in the report, want profit taken out of the sector. Back to you.